Good morning everyone, my name is Ruth Callery and I'm a registered general and children's nurse, and I'm here to talk to you about preparing a child for surgery. In this short presentation I'm going to discuss paediatric surgery, potential stressors, methods of reducing stressors, preparing a child for hospitalisation and the nurse's role in this. Our aim and objective is to highlight the importance of preparing a child and their family for a hospital stay. So, paediatric surgery. Where possible, most surgical procedures are performed as an outpatient, i.e. day surgery. However, more complex procedures will require children to stay in overnight. If these procedures are elective, it gives us an opportunity to plan in advance and prepare these children in the pre-admission clinics. However, if they are emergency cases, little time is there to prepare. Children with chronic illness may require frequent hospital stays and therefore will be in quite frequently. Hospitalisation. The hospital environment can be confusing, daunting, overwhelming and stressful for both the child and their parents. Therefore, effective strategies are needed to prepare the child and their family. This involves, first of all, identifying the needs of the child and their family, assessing the non-verbal and verbal behaviours of the child, validating any information, providing appropriate interventions, teaching and communicating, evaluating the child and family's competence in providing self-care upon discharge. So, potential stressors. Limited understanding. Depending on the child's age, they might not understand the reason why they're in hospital in this strange environment. Disruption of usual routine. Children thrive on routine. Therefore, when this is disrupted, it can lead to a lot of stress. Regression. For example, in a lot of cases, children who have been potty trained can sometimes regress and start to wear nappies again, or bedwetting, or wetting themselves. Separation anxiety. This is a very common stressor for kids who are in hospital and maybe their parents can't stay with them due to work commitments. This can be very, very stressful for children and can lead to a lot of anxiety. Loss of control. Children that may need to be restrained or confined to perform any invasive procedures can find this very stressful and quite daunting. Fear and anxiety. A lot of strange and new things happen during a child's hospital stay that can be very scary and sometimes can cause pain. Therefore, this causes a lot of anxiety. How to reduce these stressors. So, methods of reducing stressors. Use of transitional items. All children are encouraged to bring in any familiar items from home. Their teddies, dolls, DVD players, Nintendos, anything that will make them feel more comfortable in this strange environment. Rooming in. Parents are encouraged to stay with their child as much as possible. And they are definitely encouraged to stay with the child overnight to make any situation in hospital easier for the child. Child-friendly environment. Most wards have playrooms, dens, and then kids clubs which run in the evening times and over the weekends. Therapeutic play. Play specialist is very important in the ward setting. They prepare a child for theatre through play. Also, to allow the child to familiarise themselves with medical equipment through play. This is very important and can reduce a lot of stress when children get to play with it in advance before any procedure takes place. Preparation for hospitalisation. Educate the child and parents on what to expect, to separate fantasy from reality. We always encourage parents to tell children that some procedures may hurt, but that they won't last long. Describe interventions and sequence of steps. Avoid the use of any medical terms, as this can confuse children and their parents. Allow children to handle equipment. Show the child and parents around the ward. This can familiarise the child and the parents with where they will be pre-admission. Introduce the child and the parents to healthcare staff so that they know some familiar faces on the day of arrival. Adapt any information to suit the cognitive and developmental stage of the child. Use role play, as we said. This is very important, as it can be hands-on play to familiarise the child with any procedures or interventions. So, play is the most important thing that can be used to prepare a child for theatre. So we always use dolls, and we have lots of bits and pieces that we can use to familiarise the child. We show them how to put in a little cannula, which is a plastic straw that goes in under the skin to give medicine to the child. So we explain this can hurt, but that it won't last long, the pain. We can give them ECG dots that they can play with and put on dolls, just to get familiar that they will have these after any surgical procedure. We show them the masks. For a lot of kids, the mask is the most scary thing. Also, we explain that sometimes the gas that is in the mask can be quite smelly, just so they're familiar with it before they go up to theatre. They can put the mask on the doll, on themselves, on their parents, just to get them familiar with what to expect. So as you can see in the other pictures, with the dolls putting in the cannulas, the kids putting on their masks. We'll also show them the gown that they have to put on, just so they know on the morning of their operation what to expect. The nurse's role now in this. The nurse is the primary person in care of the child, and their role is to, first of all, introduce themselves to the child and their parents. Build a trusting relationship. Explain all procedures in advance. This is very important so that the child can get themselves prepared for anything that is coming, and that we can involve the play specialist to help with any procedures also. Be the child's advocate. It is the role of the nurse to be the child's advocate, to make decisions in the interest of the child. Provide comfort and reassurance for both the child and their family at all times. So, to reflect on what we've just spoke about, effective preparation of the child and their family for surgery is fundamental to ensure a safe and stress-free hospital stay. The multidisciplinary team, i.e. nurses, doctors, play specialists, anyone that's involved in the care of the child, should be utilised both pre-admission, during admission and post. Patient and family feedback should be encouraged to ensure standards are maintained and to highlight areas that may need to be improved. Thank you all for your participation. Has anybody got any questions?